The ideal ambient temperature for the room of a nursery or a child's bedroom is about 18 degrees centigrade. Now, for some people will think that's a bit cool, but in fact we know that cot death, for example, has been associated with babies who become overheated. So if we have a high temperature in the bedroom or nursery and then we wrap the child too vigorously, a baby particularly, doesn't have a mature heat regulating system like an adult does, and they rapidly become overheated, and that is associated with cot death. So a cool room and not too much bedding is a good idea, not just for infants but for toddlers as well. And that's why it's really useful to have the type of thermometer that will measure the temperature of the room itself. If the room itself is hotter or colder than it should be, that will have an influence on the body temperature when you take it. We've talked about why some parts of the body will exhibit a different temperature to others. The skin is subject to a large number of environmental factors, whether there's a draft, whether there's an air conditioning unit, whether there's a radiator, what the ambient room temperature is. So some readings are more reliable than others. The one that I favour most, and the one that doctors in hospital use all the time these days, is the ear thermometer. And this works by shining a light through a probe in the outer ear canal against the eardrum. And it gives us a very accurate reading of core body temperature. It's very quick to do, it takes less than a second, and it's reproducible. It's easy, as I say, to do, and it can be done on a regular basis so we can see how the temperature is progressing. If, however, a child is fractious because they've got an ear infection, say, and they don't want anything put near their ear, the 3-in-1 thermometer by Brother Max has the advantage of being able to use the probe as a scan across the whole of the forehead, which will detect the hottest part of the forehead and then avoid the possibility that you're missing the accurate temperature. So ear temperature first, forehead temperature second, but something that does it all in one, 3-in-1 as it were, the ambient room temperature, the eardrum temperature and the forehead temperature is an ideal thermometer to have at home. Well, if you think about the factors which can influence, say, a forehead temperature reading, we know that the skin can be cooled by perspiration. So if somebody is sweating, the temperature will be cooler. It can be greater on one side of the forehead compared to another side if someone is sitting next to, say, a radiator or an air conditioning unit. If they're wearing cosmetics or even moisturising oils, it can affect the reading. So I think it's important to be able to interpret a forehead reading on the basis of those possibilities. Many things can affect it. If they've been lying on their pillow on their front for a little while, it's going to affect the reading. If you're taking it from a part of the forehead where there are more prominent veins, the result's going to be higher than if you take it from the forehead over prominent bone. So it is important to understand that. And when it comes to the ear, which is the type of temperature checking area that doctors favour in hospitals, a lot will depend on the technique used. It's pretty easy to use the ear probe, but if you're not angulating it in the right way and hitting the eardrum with the light through the probe, then you're going to be hitting the ear canal skin itself, which is not quite as accurate as when you hit the eardrum itself. Movement of the hand of the person using the thermometer can affect the result. So can the possibility that the patient has been lying on that side as opposed to the other side. If they've recently been swimming or bathing and there's been water in the ear. The presence of earwax obstructing the light shining on the eardrum. And for these kind of reasons, it's not surprising that you might get a different result in the right ear compared to the left ear. It wouldn't be a huge difference, but there'll be some difference, and that's the explanation. So correct technique is important, and understanding of the different factors that influence temperature is important. And whether you're checking forehead results or ear results, the temperature of the room that the person's in will have a bearing on it as well, because a room that's 24 degrees centigrade compared to a room that's 16 is going to affect the body temperature to a certain extent. The thermometers which use a probe cover are designed for that very reason, and they're calibrated as such. So if you don't use a probe cover, you won't get an accurate reading. The digital in-ear thermometer made by Brother Max doesn't have a probe cover, just has to be wiped clean each time with a wet wipe or an Alco wipe, and that does the job. It shouldn't be used with a probe cover. Well, there's no doubt that practice makes perfect when becoming confident in taking your child's temperature. If you practice taking the temperature when your child is well, different times of the day, for several days, you'll know what's normal for them. You'll become familiar with the technique. And of course, having an accurate thermometer is really important. Then learning to interpret the results you're getting from that accurate thermometer by, as I say, practice, applying the results to the chart that we've already talked about, is going to give that parent a lot of confidence. Children are bombarded with all sorts of viruses and bacteria every day. So sniffles, ear infections, sore throats are very common. And it's good to be able to monitor not only from our instinct, but also what their temperature is doing, how they're getting on, and that will change over several hours during the day. So regular temperature checks and using your instinct to see how they're feeling, how they're feeding, how they're behaving, that's all important in assessing what's going on. We have to remember that children become poorly all the time. I know as my children grew up, there was always something, and they're likely to become poorly maybe 4 or 5 times a year, sometimes more than that, as they're exposed to more and more viruses. But how do we know whether their infection is just an ear infection, a short-lived tonsillitis, or something more serious, a respiratory infection caused by flu, or even something very significant like the onset of meningitis? It's sometimes very difficult to know. So all we can do is to keep an eye on what's happening, how the condition is progressing, and I think the versatility of a 3-in-1 thermometer like the one made by Brother Max offers a fantastic opportunity for parents to check on the core temperature and get an accurate reading and keep an eye on it. And when you bear in mind that it combines the opportunity to take a forehead reading using the scanner and getting an accurate reading there, and check on the ambient temperature of the room in which the child is, I think you've got a very reassuring device there that you're going to use a lot as a parent whilst your child is growing up.